Hi, I'm Nastram again from Tucson, Arizona. As of today, 900 patients have died in the United States and approximately 64,000 cases have been identified. The epicenter is moving from Europe to United States very rapidly, and it is very important for all of us to take special measures to protect us and our families from coronavirus. I'm going to discuss different aspects of coronavirus today, which include transmission of virus, how it spreads, who are at risk, and how to prevent and take precautions, and how to treat. SARS coronavirus is one of the severest form of coronavirus family. It spreads from person to person through respiratory droplets in an air or on the surfaces. Usually the virus remain viable in air for a few hours, but it can last for days on the surfaces. It is very likely that the virus is transmitting from the asymptomatic individuals. Asymptomatic individuals are the ones who does not show any signs and symptoms of illness, and this is a group of individuals who are at highest risk and can lead to spread of infection. Because when an infective patient or sick patients come to hospital with coronavirus illness, the time when he entered the hospital, he probably has transmitted that virus to at least 25 to 40 individuals in the community. Coronavirus illness can be asymptomatic, where patient does not have any signs and symptoms of illness, but they have very high viral loads in their oral cavity. It can present with acute respiratory illness, some symptoms like cough, shortness of breath, fever, and it can also present with very severe illnesses in older patient population or in certain groups who are at high risk like immunocompromised or individuals who have a history of lung disease. It can present with bilateral pneumonia, or it can present with severe respiratory illness like ARDS, and sometimes it can lead to death as well. Who are at risk for coronavirus and who should we consider at risk? So coronavirus should be considered in any person who has a fever with acute severe respiratory illness like pneumonia, ARDS, requiring hospitalization and without alternative diagnosis such as influenza. Given the increased evidence of community spread within the US, a physician suspicion for coronavirus is sufficient indication for testing for milder presentation. Close contact with recently exposed travelers and close contact with person have a confirmed infection. Regarding the laboratory testing, routine tests like complete blood count and electrolytes, they are not very specific. So corona is usually tested by a specialized technique, PCR test, but it is not widely available at this time. So clinical suspicions has its own importance. Initially, the treatment should be very supportive, which include promptly implement infection control measures, provide standard supportive management for respiratory disease, and we should try to avoid using steroids unless the patient has septic shock or acute exacerbation of COPD, because steroids usage have shown that it prolong viral replication, as we have learned from previous viral illnesses. How to reduce viral respiratory illness? So currently, anyone who has not received influenza vaccine, they should receive their vaccine, because there is no vaccine for coronavirus at this time. So the mainstay treatment is prevention. Ideally, we should wash hands at least for 20 seconds with water and soap. And if water and soap is not available, then we should use sanitizer, which should have at least 60% to 70% alcohol. Ideally, it should be with 70% alcohol. Avoid touching your eyes, mouth, and nose with unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick, because if you are sick and you're going out, you can spread the infection. Even if you don't have any symptoms, still you are at risk, because if you are in incubation period, then you can spread that infection. Cover your cough or sneeze with a tissue and then throw the tissue in the trash. Clean and disinfect frequently touch objects and surfaces. Masks are not routinely recommended it is recommended for sick patients because they can reduce spread of virus by coughing and sneezing. So for a healthy individual, masks are not important. So please do not store masks. Social distancing is very important. Everyone should avoid social events, gathering, conferences, ceremonies. And yes, personal action matters. As an individual, we all need to take responsibility to protect us and to protect others. And one way is by staying at home. A lot of individuals are thinking that even if we get sick, we'll recover. Yes, this is true, you will recover. But at the same time, you will utilize a lot of resources from the sickest patient population. So I would request everyone to stay at home for the next 2 weeks and take all those precautions which I mentioned above. Thank you very much.